So I'm going to briefly introduce the panel before we begin. We are joined by Simon Amaya Price and his father, Gareth, Claire Abernathy, of whom I talked in the speech, Elvira Saeed, and Kayla Lovedahl. Okay, so I don't think anyone here wants to hear from me anymore. So what I'd like to do is go down the panel, and we'll start here with you, Simon. Tell us your story about your experience with gender-affirming care. Once we've heard from each of you about your experiences, both as patients and as parents, I'm going to then ask, what do you wish you had been told early on in the process before treatment began? But why don't we start, Simon, with you and your story?
Yeah, first of all, I want to thank you for that amazing presentation. I think that was very balanced, very apolitical, and really great. So thank you for inviting us. Thank you for everybody who's here in the room, and thank you for everybody at home who's watching either live or after the facts. So as mentioned, my name is Simon Amaya Price, and I wrote something ahead of time, and then I didn't like it, and then I wrote another thing, and then I didn't like that either. So I'm just going to speak from the heart here. When I was 14 years old, I was going through a really tough time. I was at a new high school, and I had been ostracized by a group of friends. And shortly after, I was sexually assaulted by an older boy at my high school. After this, I sought out a therapist at Boston Children's Hospital at their Waltham location. With a combination of what I had been exposed to in school and my conversations with my therapist and obsessive Googling, as any kid in my situation would do, I concluded that I was transgender, that I was really a girl inside. I told my therapist this, and she immediately affirmed me. She said, I'm so brave. She told me not only that I'm brave, but at the same time that she had given instructions to my father to count all the knives in the drawer because I was at risk of self-harm, she encouraged me to go behind my parents' backs to attend transgender support groups. I was referred to the gender clinic by her, my psychopharmacologist, and my pediatrician. Around my 15th birthday, I remember meeting with my pediatrician, sharing with him my transgender identity and my gender dysphoria diagnosis. I told him that my dad was refusing to take me to the gender clinic. The pediatrician then asked my dad in front of me, would you like a dead son or a living daughter? This isn't just a line used by activists. This is a line used in healthcare settings by the doctors that your kids are seeing in your communities all across this country. I'm one of the lucky ones. I only socially transitioned. I only lost a couple years of my life. I didn't lose any body parts. I thank God every day, whether or not he exists, that I'm whole and I'm here today. I was lied to by the medical professionals I was supposed to trust, the same medical professionals who gave me antibiotics when I had strep. I was told that changing my name, my pronouns, socially transitioning, taking cross-sex hormones, undergoing surgeries would fix me. That was all a lie, and I'm here telling you that today. If I were there again, I really wish that my doctors would have asked me about any history of sexual assault. Maybe if they would have talked about the 2 years of homophobic bullying I endured in 7th and 8th grade, where kids threatened to kill me and called me the F slur on a near daily basis, maybe that would have helped, instead of telling me I was really a girl inside and reaffirming my delusions. I wish they told me that I was born in the right body, that I am perfect just the way I was, because nobody told me that. Nobody I paid attention to, at least. Wanted to put that in there for you, Dad. And I'm lucky. And look, I could have gotten hormones when I was 16, but COVID happened, and I was out in Western Massachusetts for college. And my dad worked as a statistician at Raytheon, so an expert in evaluating methodology and statistical relevance. He read up on all of the science. He is the only reason I am here in front of you today, full in one piece, unharmed. Please give him a round of applause. We cannot expect every parent to be a trained statistician, and that's why we are here today. What else do you want to know?
That was great, Simon. Thank you.
Thank you.
Thank you for speaking from the heart. Gareth, tell us what this is like as a parent.
Well, I'm going to stick to my prepared remarks. Hello, I'm the father of a 21-year-old man. He was born male 21 years ago, and he's been male every day since, even when he and medical professionals told me he wasn't anymore. They were wrong, and the proof is right next to me. In the spring of 2019, when my son was 14 in the 9th grade, he began seeing a therapist and psychopharmacologist at Boston Children's Hospital in Waltham because he was in great distress, suffering from anxiety, depression, confusion, and intrusive thoughts. Our son had already told my wife and me that he believed he was really a girl inside, after which I embarked on weeks of research about the nature and social manifestation of trans ideation in adolescence, all of which validated my instinctive response that it was delusional. Our son did not always have a happy childhood, in part because of the confusion caused by undiagnosed autism, and puberty was traumatic for him. He cried if a gas station closed. His own body changing upset him profoundly. He was a target of bullying both by boys, physically, and by girls, socially. The boys threatened him and called him homophobic slurs, and the girls shunned him, mostly for not acting like they thought a boy was supposed to. The psychiatrist and psychopharmacologist at Boston Children's were supposed to be treating him for anxiety and depression, but when he told them both he believed he was really a girl in a boy's body, they repeatedly suggested to me that I should take him to Boston Children's Gender Center, GEMS. I deflected these suggestions and encouraged them to refocus on his anxiety and depression. I already knew then what is public knowledge now, that GEMS universally agreed kids were the wrong gender and only gave a cursory assessment before recommending medical intervention. The psychiatrist did not like it that I did not take my son to GEMS. I felt I had to walk on eggshells to avoid her recommending to child services that my son be taken away from our family by CPS. She had already suggested he be put in an inpatient facility. I believed that his anxiety and depression, his trans ideation, was caused by his anxiety and depression, not vice versa, and that concretizing this delusion through medicalization was a terrible idea. I was right, but I had to keep quiet. At the same time that I was instructed to keep our son under close watch for self-harm, the psychiatrist at Boston Children's was telling him, behind my back, to sneak away from home and go to a transgender support group. I was counting knives in the drawers and checking on him every half hour, and she was telling him to lie to me and escape my supervision. That June, at his annual pediatric visit, my son told his doctor, who had known us for several years, that he was really a girl inside. The doctor immediately agreed and offered to refer him to GEMS. I told the doctor I thought that was absurd, as I had known the boy his entire life, and that transgenderism was a phase he would get over, a temporary result of his adolescent misery. I knew then that research supported my view, and now hindsight does too. The pediatrician told me he sent every kid who said he was transgender to GEMS. When I told the pediatrician I didn't intend to take him to GEMS, he asked me, in front of my son, whether I would like a dead son or a living daughter. That was emotional blackmail. And in my opinion, malpractice. I chewed the pediatrician out thoroughly for that abuse, and we never saw him again. He quit the practice. I think he should have quit the profession. But he just moved one town over and manages a practice there now. I shudder to think how many kids he's medicalized by now. Later that spring, the Boston children's psychiatrist and psychopharmacologist refused to keep treating my son and referred us to a private pay facility. I can't say the name of that facility because they did a good job treating his anxiety and depression. And treating a child with transgender ideation in any other way than so-called affirmation therapy is illegal in Massachusetts. As I suggested to the several medical professionals who tried to get me to chemically castrate my son, he eventually outgrew the idea that he was really female on the inside and reconciled himself with his sex. Here he is today, a happy and healthy man.
Claire, tell us your story.
Hello, friends. Is this on? Hi, friends. First, I want to a little disclaimer that I wear my heart on my sleeve, so please don't mind my voice shaking while I speak. I want to thank the Federal Trade Commission for inviting me to speak today. I'm grateful for the chance to share my story because I believe that what happened to me and what's still happening to so many others is an urgent matter of consumer protection and fraud. My name is Claire, and I'm a detransitioner. A week after I turned 14 years old, I was put on testosterone by Dr. May Lau at Cook Children's Hospital in Dallas, Texas. 6 months later, Dr. Alan Doolin with the American Institute for Plastic Surgery in Plano performed a double mastectomy on me. I was too young. I was too young to get a tattoo. I was too young to drive. I hadn't even learned, thank you. Thank you, Jamie. I hadn't even learned algebra in high school yet. But I was old enough to choose to have healthy parts of my body electively amputated. I was sold a product, medical transition, by professionals and institutions who told me that it would fix my distress and save my life. I was told that if I didn't do this, I would probably end up dead. But here's what they didn't tell me. They didn't tell me that taking cross-sex hormones and undergoing major surgery at 14 years old could leave me with pelvic floor dysfunction and urinary incontinence, problems I have to manage now as a young adult. I'm only 20 years old. They didn't tell me that these complications are common enough to be known risks, and yet they were hidden from me at an age where I didn't even understand what these terms meant, let alone the impact they would have on my daily life. And it doesn't stop there. When I tried to warn others by leaving honest reviews on my surgeon's websites, describing my regret, the complications, the lack of real informed consent, my reviews were deleted. Think about that. A surgeon permanently altered my healthy body when I was a middle school student and then erased my negative feedback to protect his reputation. If that doesn't sound like fraud, I don't know what does. In any other context, selling a medical product in this way, with half-truths and hidden side effects, would be considered fraud. If a pharmaceutical company pushed a drug on children without disclosing the lifelong damage it can cause, they would be sued out of existence. If a cosmetic surgeon buried evidence of complications, they would be shut down. But when it comes to gender medicine, it's not just allowed, it's celebrated. and anyone who asks questions is called hateful. Every week, I hear from more young men and women like me, people who were convinced as kids or as teenagers that the only way to survive was to become a lifelong medical patient. We now live with the irreversible consequences, the scars, the side effects, the pain, and the grief. And we watch helplessly as the same professionals and clinics keep selling the same product to the next generation of vulnerable kids while silencing those of us who speak out. Let me be clear. It is not in my wheelhouse to say that no one should ever transition. I'm here to say that when you sell a product, especially one that removes healthy body parts and alters your life forever, the consumer deserves the whole truth. They deserve honest disclosure of all of the risks, possible outcomes like regret, and alternative treatment options. They deserve the right to share their negative experiences without being censored. At 14, I trusted the adults who were supposed to protect me. Instead, they sold me a dream that turned out to be a nightmare. That's not healthcare, it's blatant consumer fraud. I want to thank the FTC and those in the audience again for giving people like me a seat at the table. Please hold these providers and pharmaceutical companies to the same standards as any other industry. We need real informed consent, we need oversight, and we need to make sure that no more kids are sold a product they can't return. Thank you for listening.
Thank you for your tremendous courage, Claire. Elvira, let's hear from you.
Good morning, everyone. First, I want to thank FTC for having me here and giving me this opportunity to share the tragic story of our family. My name is Elvira Said, and I lost my I'm sorry. I lost my 18-year-old daughter. Eileen. To gender ideology. And to a system that failed her at every step. Eileen was exceptional. Despite being on autism spectrum, she spoke 4 languages, played 5 instruments, held 2 black belts in martial arts, and earned a full tuition scholarship to Rider University. But behind all those accomplishments was a young woman silently battling anxiety, depression, trauma, and self-harm, especially after losing her father to cancer at age 12. During the pandemic, like many other kids, she spent too much time online. And after cycling through several LGBTQ labels, she finally declared she was transgender. Before college, she began seeing a therapist who immediately affirmed her identity. No question asked, no effort to understand her trauma or mental health, no curiosity about why this identity emerged so suddenly. When she got to campus, things got worsened. She cut me off. And at the age of 17, at that point, she was introduced to a transgender pastor from Metropolitan Community Church in Hartford. Someone who barely knew her, but filed a complaint against me with the Department of Children and Families. Why? Because I refused to accept my son's identity. The goal was to remove me so the state could step in and give Eileen all the care she supposedly needed. From that moment, I lost any access to my daughter. I would like to thank Project Veritas for taking a deeper investigation and finding out that that pastor who filed that complaint against me was providing free binders to minors behind their parents' back. In January 2024, Eileen began therapy at the Pride Center, referred by Rider University. The therapist there, a transgender man, also affirmed her. And I have to wonder, was this therapist affirming Eileen solely because that's what modern guidelines encourage? Or was it also because of her own subjective viewpoint, her personal identity? Was this care or ideology disguised as therapy? In the therapist's own notes, she documented Eileen's history of self-harm, suicidal ideation, and autism spectrum disorder. On one entry, she wrote, "The client stated that most of the time he's feeling blank when he zones out or can't remember, and other times it is like he's watching himself through a screen." To me, this is a massive red flag: dissociation, detachment, instability. But no follow-up was done, no second opinion, no attempt to contact me, her only living parent. Instead, the therapist reinforced Eileen's belief that I was unsafe to be around and referred her to an endocrinologist. When I finally saw the endocrinologist notes after Eileen's death, they mentioned only anxiety and depression. Nothing about suicidal thoughts, nothing about trauma, nothing about self-harm. Her visit was marked as a well visit. There was no physical exam, no mention of the visible scars on her arms, no signs that her condition was truly assessed, and absolutely no indication of an endocrine disorder that would justify a prescription for hormones. And when talking about side effects, the only side effect discussed was fertility. On that very first visit, Eileen was given a prescription for 40 milligrams of testosterone per week and a referral for double mastectomy on that very first visit. In that referral letter, the doctor, or APRN, falsely claimed that Eileen had dreamed of being a boy since age 8. That was never true. My insurance was charged for this against my will. When I saw this pharmacy alert, I was horrified. Testosterone can increase aggression, emotional numbness, and suicidal thoughts, especially in a vulnerable, unstable teen. But no one stopped to ask if it was safe. On just her second visit, APRN increased her dose to 60 milligrams per week. Even though her chart noted worsening side effects like acne and bleeding, her testosterone level at that point was 289. For reference, the normal female range does not exceed 45. In October 2024, my daughter died by suicide. She overdosed on Benadryl. Her body lay in her dorm for 4 days before anyone found her. The school waited another day to call me. During that time, they were celebrating National Coming Out Day. The autopsy revealed new self-harm wounds on her thighs. According to the detective report, her friends said Eileen's depression was getting worse. She was struggling, and she was having difficulty with transition. Those entrusted with her care didn't treat her depression. They didn't explore what was underneath the identity. They didn't even tell me what was going on. They treated her ideology, not her illness. What she got instead was a fast-track prescription and an ideology that told her pain was proof she needed to keep going down that path. Eileen deserved better. Every child does. And answering your question, Chairman Ferguson, what would I wish was different? I wish Eileen had met the very true therapist who would really care about her, not about promoting an ideology on a vulnerable teen. Because therapy is not identity validation. It's a life and death guidance, and if done poorly, it leads to the irreversible, sometimes fatal consequences.
Thank you so much, Elvira. Kayla, let's hear from you.
Hello and good morning to everyone here. My name is Kayla Lepdahl. I go by Layla Jane online, and I am a survivor of gender medicine or a detransitioner. I am someone who has been dosed with Lupron and testosterone starting at 12. I received a bilateral mastectomy just 1 month after my 13th birthday. I went straight from training bras to binding, straight to the operating table at 13. The reason why is because I had undiagnosed autism, and unaddressed childhood sexual trauma. I was scared to become a woman. I was getting unwanted male attention, which made me fearful of being victimized again. I had sensory issues I didn't know how to cope with when I began menstruating and needing bras. I learned about transgenderism at 11, and I thought maybe that was the reason I was so uncomfortable. I brought the idea to the therapist I'd been seeing, and she immediately affirmed me, gave me a diagnosis of gender dysphoria, and once I told my parents, she began writing referrals for doctors specializing in pediatric transition care. Never along the way did anyone question why I suddenly wanted to become a boy. They didn't comprehensively screen me for mental health disorders or ask me about any prior trauma. I saw Suzanne Watson in Kaiser Oakland's Proud Clinic, and within 90 minutes, she signed off for me to receive testosterone and meet with a surgeon named Winnie Tong. The mastectomy was explained to me at 12 using watered-down terms like top surgery. I was told I would never be able to chest feed. I was told I might lose sensation, but to me, at 12, that equated to numbness. But today I deal with nerve pain, extreme slicing sensations, electrical zaps, and itchiness. I could scratch my skin until I bleed, but with no relief because the skin is numb and doesn't register touch. However, the nerves underneath are erratic. I'm nearing 8 years post-op this September. As you can probably all tell, my voice is permanently lowered from the testosterone I took from 12 to 17. I do have a slight Adam's apple. I can't raise my voice for long periods of time. I can't scream if I'm in danger. Mind you, I'm a pretty small person, standing at about 4'11". I still grow facial hair that I have to deal with. I have atrophy and urinary issues. Testosterone also damaged my liver. I've had fatty liver disease since about 14. The Lupron essentially put my body in menopause. I gained weight. My psychiatric issues flared up. I experienced intense hot flashes, which made it really difficult to focus on my 7th grade homework. Today, I live with chronic joint pain. I'm only 20. At no point along the way was I offered an off-ramp. I didn't even know what detransition was until I was almost 18 and began to taper myself off the hormones, scared to go back to the doctors. Even at 18, I called member services and requested my name and gender marker be switched back and to receive a new insurance card to reflect that change. Weeks later, I received one in the mail with my male name. I'm here today to speak out against gender-affirming medical practices for minors. We are letting vulnerable children be irreversibly harmed by a medical system that affirms without asking why. We need to protect children from these rushed experimental interventions. Let kids grow up whole. Thank you.
I don't think anything could be added to what we just heard. And so I'm going to close with only 2 comments. First, I'm not sure in my life I've ever seen more courage displayed than what I just witnessed in the last 30 minutes. And second, I want you to know the FTC hears you. We hear all of you. We want to understand what's going on so that if the law is being broken, we can stop it. So thank you for being here for this today.